Hello everybody, welcome to today's video where we're going to be taking a look at that press conference and reacting to the sheriff and the coroner's report, the unanswered questions, the complexity of the scene, the body language. For a lot of people, things aren't adding up, people like you and myself. Now, there's a lot of highlights in the news about Betty Arakawa's supposed cause of death, and they're given a lot of verbal evidence about this, that it is a strain of the Hantavirus, which has a lot of viruses in that category. They're mostly not fatal from what I understand. It's very rare. But a lot of rare things went on to have 3 individuals pass on basically in the same time period. There's a lot of highlights on the news about Betty Arakawa passing on before Gene Hackman, a whole week before. This is the timeline that they're giving us. So we're going to get into why they believe it is what it is, and see if they really have unraveled this to our satisfaction, because it is bizarre. But one thing we know is that they were not being looked after. Betty Arakawa's last movements, you see it all in the news on February 11th, and it seemed like a lot of things happened in this week leading up to their passing for a couple that was very private and not often seen. So we're going to have to sift through this press conference to find things that satisfy, I think, a lot of obvious questions that we have. I think my questions are obvious. I will react to the press conference at the appropriate time. It's a whole nother story how these people were just lacking a support system, especially Gene Hackman with his advanced age. It's really something I'll talk about in another video because that's a whole thing in and of itself, as evidenced by Betty Arakawa laying long enough to have her limbs mummified. They never specified in any report that Gene Hackman's limbs mummified, but that they were separate and that he was in this mud room. We heard that time and time again. And also that there was no foul play suspected. They don't find that a factor. I suspect in this press conference, they're going to try to support that original theory, and let's see if they did it. And please do comment, weigh in, give me your opinions, because this just was not a simple passing. We lost a lot of people in the last weeks, and this case right here is a very suspicious, complexing scene that surrounded Gene Hackman when he passed, as well as his wife and his dog. So let's get into it.
Good afternoon, everybody. I'm Sheriff Adan Mendoza, Santa Fe County Sheriff's Office. With me today is Dr. Heather Giral, Chief Medical Investigator for the New Mexico Office of the Medical Investigator. Dr. Aaron Phipps, New Mexico State Public Health Veterinarian, New Mexico Department of Health, and also Chief Brian Moya, Santa Fe City Fire Department. This investigation started on February 26th with the discovery of Mr. Hackman and Ms. Arakawa and their dog at the residence. I just want to do a short recap and then touch on some new information. As we know, both individuals tested negative for carbon monoxide. City Fire conducted tests and deemed scene safe for deputies to conduct their investigation. The preliminary pacemaker interrogation results were released last week, and I'll let Dr. Giral touch more specifically on those results. The gas company New Mexico, they also did an analysis of the residence, and they found one minor leak in a single burner on the kitchen stove, which was 0.33% of room air, which was pretty minute and insignificant. Since that time, Xena, the deceased dog, has been taken for necropsy at the Veterinary Diagnostic Services, and we'll be awaiting those results. Let's speak a little bit in reference to the timeline for Betsy Arakawa. We know from our investigation that on February 9th, 2025, she picked up Xena from Gruta Veterinary Hospital. There was a procedure that was done with the dog, which may explain why the dog was in a crate at the residence. Let's move on to February 11th, 2025. Mrs. Arakawa had an email conversation with her massage therapist at about 11:21 a.m. Moving on into the afternoon, Miss Arakawa was at the Sprouts Farmers Market between 3:30 and 4:15 p.m. Miss Arakawa was seen on surveillance video at the CVS pharmacy in Santa Fe from 4:12 to 4:20 p.m. She then stopped at a local pet food store at about 4:54 p.m. Her car was seen on surveillance, and the remote control clicker that is assigned to her and her vehicle was used to enter the subdivision to gain access to the gated community at 5:15 p.m.
Betty Arakawa picks up the dog on February 9th because of this procedure, and investigators seem to believe that explains the dog being in a crate, but it doesn't quite explain the dog being locked away in a closet. This has come up in numerous reports that the dog, that was the first thing they said. They never even mentioned that the dog was in a kennel, that the dog was a few feet away from her, closed away, locked away in the closet. And they always describe these three individuals as being in separate places. So a closet locked away, you can't really take that back. And Betty Arakawa was picking up pills on the 11th. Um, she's at the pharmacy. And then that ties back to her having uh and that ties back to her having medications and that ties back to her having various medication strewed all over her vanity in her bathroom area. So it's very odd. But she did pick up some food. It will be very interesting to know what she discussed with her massage therapist. I can only imagine that this is about an upcoming appointment, or scheduling of an appointment, or the cancellation of an appointment. That'll be really interesting to know.
Numerous emails were unopened on her computer on February 11th. There was no additional outgoing communication from her or known activity after February 11th, 2025. The cell phone information and the cell phone data is pending. We're working with state police to get the information from those phones, but our investigation shows that all the last known communication and activity from Ms. Arakawa was on February 11th. I'm going to go ahead and turn over the podium to Dr. Gerald. I would ask that everybody refrain from asking questions until everybody has provided their statements. I'll step up to the podium, and then we'll go ahead and field questions from the media. Thank you.
Very short statement, very brief statement.
Good afternoon, and thank you for being here. I'm Dr. Heather Gerald, the Chief Medical Examiner for New Mexico at the Office of the Medical Investigator. I'd like to begin by stating that it is unprecedented for the Office of the Medical Investigator to make public statements about death investigations. However, the circumstances surrounding these two deaths require accurate dissemination of important information. I've also spoken with the Hackman family prior to this conference, who are aware of the autopsy findings and conclusions and are aware of this conference. On Thursday, February 27th, I performed an autopsy on Mr. Gene Hackman. Medical examiner Dr. Daniel Gallego at the Office of the Medical Investigator performed a full autopsy on Miss Betsy Arakawa Hackman, also on Thursday, February 27th. By report, Miss Arakawa Hackman's legal name is Betsy Hackman, which is how she will be referred to hereafter. The cause of death for Miss Betsy Hackman, aged 65 years, is Hantavirus pulmonary syndrome. The manner of death is natural. Autopsy examination and full body postmortem CT demonstrated no findings of trauma internally or externally. with microscopic findings consistent with Hantavirus pulmonary syndrome. Laboratory testing was positive for hantavirus at a clinical lab, with required confirmation testing positive at Scientific Laboratories Division. Testing for COVID-19, influenza, and other common respiratory viruses was negative. Testing for carbon monoxide was negative.
Let me pause right there.
There were no
Jump in about the hantavirus. Because it is rare. They mentioned that in another press conference. It is so rare that there's been under 10 cases, I think something like 5 or 7 in Santa Fe in the last decades. And their bodies were discovered by basically grounds workers, people that care for the exterior of the property because they don't really have staff going in and out of their home, the Hackmans. So could Miss Arakawa have been doing some work by herself that she was exposed to droppings and Gene Hackman not? Uh, I would wonder why. And with Betty Arakawa being the sole caregiver, and you'll hear them mention, they mention in other conferences, or they mentioned in other reports how she was seen with a face mask on. Being the sole caregiver for Gene Hackman, she's wearing a face mask to protect the public from her or to protect herself from the public. She knows if she falls ill that Gene Hackman is left without support. Something is really not right about this whole thing. And they mentioned that they told the family about this press conference. The family's aware of the press conference. Like I said before, that's a whole can of worms. No disrespect to the family. Some people don't have the closest relationships with their parents or the elders in the family. Betty Arakawa had to, at the very least, know that she was ill and that she would be exposing Gene Hackman to whatever she had. So she was gone to the pharmacy for something, for some reason. She's taking medication for some reason. She's taking the dog to the vet. She's failing to take care of her own body with someone in Betty Arakawa's situation where she knows she's the sole caregiver and no one is checking for Gene Hackman and Betty Arakawa. Their family is the family is not around them like that. You don't hear about the grandchildren popping up calling, let's see grandpa. I mean, with the hantavirus being believed to be the cause of Betty Arakawa's passing, it just seems like she had to symptomatically, obviously, have symptoms that would make her think, I don't want to expose Gene Hackman, a man with advanced age, frail, to whatever I have. That's the only thing that makes sense. So why that didn't happen? Lingering question. Dr. Heather Gerald is also seems to be quite nervous. I don't know if it's from the gravity of the case. I've seen other people comment about this. Her breathing is very heavy, and she probably is not used to being in the spotlight because that is not the job of the coroner to address the public directly. So that's a whole thing for her. And she's looking nice. She made herself ready for the camera. But it seems like the weight of this case is really a lot for her.
There were no other significant natural disease findings. Pills present on scene were thyroid medication, which were being taken as prescribed and is not currently a concern for a contributory cause of death. The cause of death for Mr. Gene Hackman, aged 95 years, is hypertensive and atherosclerotic cardiovascular disease, with Alzheimer's disease as a significant contributory factor. Autopsy examination and a full body postmortem CT examination demonstrated no acute findings of internal or external trauma and showed severe heart disease, including multiple surgical procedures involving the heart, evidence of prior heart attacks, and severe changes of the kidneys due to chronic high blood pressure. Examination of the brain showed advanced Alzheimer's disease, as well as blood vessel changes in the brain secondary to chronic high blood pressure. Laboratory testing performed at Scientific Laboratories Division was negative for COVID-19, influenza, and other common respiratory viruses. Testing for Hantavirus was negative. Testing for carbon monoxide was negative. Additionally, there were no autopsy findings concerning for hantavirus infection. I have been asked when death occurred for these individuals. There is no reliable scientific method to accurately determine the exact time or date of death. Mr. Hackman's initial pacemaker data revealed cardiac activity on February 17th, with subsequent pacemaker interrogation demonstrating an abnormal rhythm of atrial fibrillation on February 18th, which was the last record of heart activity. Based on this information, it is reasonable to conclude that Mr. Hackman probably died around February 18th. Based on the circumstances, it is reasonable to conclude that Ms. Hackman passed away first, with February 11th being the last time that she was known to be alive. Lastly, clinically, hantavirus infection is characterized by flu-like symptoms consisting of fever, muscle aches, cough, sometimes vomiting and diarrhea that can progress to shortness of breath and cardiac or heart failure and lung failure. This occurs after a 1 to 8 week exposure to excrement from a primarily particular mouse species that carries hantavirus. The mortality of hantavirus, the mortality rate of the hantavirus strain in the Southwest is about 38 to 50%. The hantavirus strains in the United States are not transmissible from person to person. And so this is an appropriate time to segue to Dr. Aaron Phipps, the state public health veterinarian with the New Mexico Department of Health. But before I do so, I'd like to kindly ask for everyone to please respect the privacy that Mr. Gene Hackman, Miss Betsy Hackman, and their family and friends deserve. Thank you.
I'm going to pause right there. It's just really amazing to me how much she's sharing about hantavirus, and so much is in the news, all the highlights about hantavirus that I looked it up. It is so rare. What I found in my research is that is a category of viruses, and mostly it is less than 1 till 15% of the cases are fatal. It is so rare. I mean, the way the math is broken down. And she just expands on this and expands on this. And again, why Gene Hackman wasn't exposed to it, you could argue some things, but why she would be anywhere around with a well kept home, anywhere around where fecal droppings may be, and that she would carry these symptoms without considering that she would pass these on to Gene Hackman. And then the coroner going on to say, please respect the family's privacy. Gene Hackman, we don't know what was going on with his family situation. We know that he is a legend and that he is a great. Of course, we're going to respect his family, but you got to tell us something that quells our suspicion that, this is not really doing it. And why she takes the lead in saying, respect his family. I haven't found anything disrespectful online. I'm sure it's there, but everyone just it's we are not happy to hear that this man was neglected. He was neglected, and Betty, in all of her caring for him, she had no support. I'll just go on.
Thank you, Dr. Gerald. I will now provide additional information about hantaviruses in New Mexico. There are many different types of hantaviruses found worldwide. These viruses are zoonotic, meaning they are transmitted from animals to humans. Hantaviruses are carried by rodents. The hantavirus found in New Mexico, the sin nombre virus, is found throughout the state, primarily in deer mice, but in other rodents as well. Hantavirus pulmonary syndrome is a rare disease caused by hantaviruses, but a small number of human infections are found every year in New Mexico. Over the past 5 years, New Mexico has confirmed between 1 and 7 hantavirus infections in humans each year. Through the end of 2024, we have identified 136 infections over the past 50 years in New Mexico residents, 5 of these in Santa Fe County. This is a serious disease. 42% of these infections here in New Mexico were fatal. Most transmission occurs around the patient's residence or workplace, and the New Mexico Department of Health typically conducts an environmental investigation at the residence of all hantavirus cases in our jurisdiction. This can help identify specific areas that may pose higher risk, providing insight into where transmission may have occurred and how.
I would pause right there. This hantavirus sounds almost as rare, like some old disease from the Bible, like leprosy or something. Um, even these, I mean, she speaks about 136 cases in the last 50 years. It sounds like, uh, if you really research this, that it could be something that happened during an outbreak, like maybe 110 of those cases all happened maybe in a 1 month period. I'm not laughing about the disease because clearly no one wants to be visited by uh this virus, but that they spend so much time. I feel like I'm in school learning about an old disease. It's, hey, they really selling this story, but I'll go on.
How to prevent future infections. On March 5th, the New Mexico Department of Health staff conducted a risk assessment of the property, including the main residence as well as other structures on the property. This was critically important to address concerns about health risks to first responders, as well as to inform any prevention measures needed to protect the family and other individuals entering the property in the future. We assessed the risk of exposure in the primary residence as low, similar to other well-maintained houses in New Mexico. We did identify signs of rodent entry in other structures on the property and provided information and resources about reducing the risk of hantavirus transmission related to those areas. Hantavirus can be transmitted to people through rodent urine, droppings, or saliva, so it is important to take special steps when cleaning up after rodents. Avoiding contact with or breathing in aerosolized rodent urine or feces, especially in a poorly ventilated area, is key. Detailed guidance can be found on the New Mexico Department of Health and the CDC websites, but I will provide a very brief summary now.
I might just skip that when I upload this video. Again, terrible situation to be visited by this virus. But when we believe that Betty Arakawa contracted this virus, she would be walking around with some horrific symptoms. I mean, clearly, if they lead to her passing. So, this whole thing, if this is a public safety announcement, great. I don't think this is the time to really do that. Maybe, or I don't know. I don't know. Maybe it is a good time to do it. Alert the public at the same time because our awareness and our focus is very heavy on Gene Hackman.
Use gloves and a well-fitting N95 mask when around or cleaning rodent-infested areas, and to open any windows or doors for at least 30 minutes beforehand to increase ventilation. Spray the area thoroughly with a 10% bleach solution or a commercial disinfectant. Let it sit for 5 minutes. Next, clean the area with paper towels, then throw them away in a covered garbage can that is regularly emptied. Before removing gloves, Wash your gloved hands with soap and water or with a disinfectant. And then after removing gloves, wash your hands again with soap and water. It's important to never sweep up or vacuum mouse droppings, since this can spread particles up into the air. Since hantavirus is found throughout New Mexico, awareness of these risks and how to reduce them is important for all New Mexicans. The New Mexico Department of Health extends our deepest condolences to the families and friends during this difficult time. Thank you.
Thank you. I think that'll conclude the statements for today. We will go ahead and take questions. I ask that there be one question per agency, and please state who you're directing the question to, as there's several individuals here at this conference. Sir.
Sheriff, just to clarify the timeline here, does this mean Gene Hackman was likely home with his deceased wife for a week before he passed away himself?
Yes, I would assume that that is the case.
Given his Alzheimer's status, that Mr. Hackman was able to live on his own and survive for those 7 days?
I think that's more a question, maybe for Dr. Jarrell.
Just to repeat so that everyone could hear, the question was, do we believe that Mr. Hackman was able to live on his own and survive? The answer to that question is that Mr. Hackman showed evidence of advanced Alzheimer's disease. I'm not aware of what his normal daily functioning capability was. He was in a very poor state of health. He had significant heart disease, and I think ultimately that is what resulted in his death. I was able to look at fluid to determine if he was dehydrated, and I did not see evidence of dehydration. I did see evidence of very poor kidney function, and I think he died as a result of his heart disease. And
Okay, I have to pause right there. You heard her say very clearly that Mr. Hackman was in a very poor state of health, very poor health condition, completely contradicts what his daughter said, that he was doing great. He's doing Pilates and yoga. Betty really looks after him. Even if Betty really did look after him, she's one little woman, one petite woman taking care of this man's entire needs. And he's 95. You know, some 95-year-olds, they dance and all that, but clearly, as we saw in some of the video, um, that's been released, that Mr. Hackman, Gene Hackman, was frail. He was really frail. So this is a really big inconsistency.
just to repeat so that everyone could hear, the question was, do we believe that Mr. Hackman was able to live on his own and survive? The answer to that question is that Mr. Hackman showed evidence of advanced Alzheimer's disease. I'm not aware of what his normal daily functioning capability was. He was in a very poor state of health. He had significant heart disease, and I think ultimately that is what resulted in his death. I was able to look at fluid to determine if he was dehydrated, and I did not see evidence of dehydration. I did see evidence of very poor kidney function, and I think he died as a result of his heart disease, and with Alzheimer's being that contributing factor.
What about starvation?
The question was, what about starvation? So there was no food in his stomach, which means he had not eaten recently, but he had also no evidence of dehydration.
So based on your understanding of the progression of the Alzheimer's, do you believe that he was possibly not aware that his wife had died or didn't know what to do in that situation?
It's difficult to answer. The question was he aware that Ms. Hackman had died? And I think that question's difficult to answer, but I can tell you that he was in an advanced state of Alzheimer's, and it's quite possible that he was not aware that she was deceased.
This is for the sheriff.
I'm going to pause right there before the next question. I witnessed someone with, I don't even know if you would consider it advanced stages of Alzheimer's. I visited a woman and her grandfather was going through, uh, I visited a woman and her grandfather had Alzheimer's. And what I saw with that man, every time she tried to put him to bed, she's like, Papa, it's time to go to bed. And he's like, no, I don't like going to bed without Cindy. I can't sleep without Cindy. And she's, oh, Papa, she's not coming. She's not coming. Why isn't she coming? Of course she's coming. He 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 relived this like 6 times. Of course she's coming. She died. And he would cry. I mean, he would go through misery. He was actually crying. It completely broke my heart. And then it would happen again. And I'm like, that's Alzheimer's. And with Alzheimer's and Betty having uh, gone through a process of partial mummification, why would Gene Hackman be in the mud room with his sunglasses nearby and his walking stick in these very separate parts of the home? It's a confusing scene. Is it? But I'll move on.
Considering the circumstances under which Mr. Hackman was found in the mudroom with his walking cane and sunglasses by him, do you think there is a possibility that he was trying to get help for his wife?
That's hard to answer. Again, it's hard to get into the frame of mind of what was happening at the time, and I don't know if we'll ever have the answer to that question, whether he was going to go for help or he wasn't. Sir.
Sheriff, are there any other big questions that you're trying to answer? I mean, does this answer the biggest questions you had about their death in this case? Is there anything else that you're really seeking?
Yeah. So the question is there any other big questions that are left? I think a lot of questions were answered here today. I think there was, Dr. Durrell went over the cause of death, and I think a lot of those questions are answered. I think the timeline that we've been given as far as the pacemaker results and the history and evidence that we found as far as the timeline of Miss Arakawa, I think a lot of the questions have been answered. We are waiting on the cell phones, but I would very unlikely that the cell phones are going to show anything else. Another question?
Are there any signs of, what have you learned about Mr. Hackman's communication after February 11th? Did you talk to any friends of his who had spoken with him during that week-long period, or know anything about what he was doing?
So the question is whether there was any communication from Mr. Hackman or activity, and no, at this point, no. I don't know if he used cell phones or technology or emails. There's no indication of that. So right now there is no activity from Mr. Hackman.
Sheriff, do you know if his pacemaker was connected to some sort of monitoring service? Was anyone tipped off that something was...
Wann gab es zuletzt einen so schönen
Evidence that we found as far as the timeline of Miss Arakawa, I think a lot of the questions have been answered. We are waiting on the cell phones, but I would very unlikely that the cell phones are going to show anything else. Another question?
Are there any signs of, what have you learned about Mr. Hackman's communication after February 11th? Did you talk to any friends of his who had spoken with him during that week-long period, or know anything about what he was doing?
So the question is whether there was any communication from Mr. Hackman or activity, and no, at this point, no. I don't know if he used cell phones or technology or emails. There's no indication of that. So right now there is no activity from Mr. Hackman.
Sheriff, do you know if his pacemaker was connected to some sort of monitoring service? Was anyone tipped off that something was wrong?
The question was his pacemaker connected to a monitoring service? The answer to that is that his physician, one of his physicians, had contacted me and told me that they could see the data from the 17th, but that to really get the most information from that would come from the interrogation of the pacemaker. And that's as much as I can answer, not being a cardiologist.
They didn't say whether or not they were monitoring, or was his pacemaker equipped to send back data in that time so that someone could say, hey, something's not right?
I can't answer that question. I'm sorry.
Pause. Because that technology is available. There are so many options with pacemakers that you can have a doctor monitor you. They can know within minutes if something is going on with you, if you're having an unwanted event. So, what Gene Hackman's financial situation was, I mean, you have to pray. Excuse me, you have to pay property taxes on a $3 million estate. So I don't think Gene Hackman would be struggling to cover the cost of those type of options. It's all bizarre. And Gene Hackman being separated from his wife, Betty, that had to happen on numerous occasions, just like on February 11th when she went to run errands, just like on February 9th when she went to look after the dog, picking him up from the veterinarian because she has to run errands. This is an elderly man. So, in case of emergency, you have to think of that. I would think of wouldn't anyone think of that if something happens while I'm not here? Like those medic alert bracelets, like I've fallen and I can't get up. Things happen with seniors all the time. Even young people have freak accidents. That's why I told my mother was doing some, I'm like, Mom, no, you can't do that kind of stuff. Even young people have freak accidents with that. Don't do that. And I talk to my sisters, I talk to my daughters, like, no, if you hear about mom doing some stuff, it's like time out for that stuff. It's over. Stop the unnecessary risks. So you leaving your elderly loved one by themselves, even for an errand, and no one else cares for them, you have to have some kind of panic, something. So for Gene Hackman to be alone, and even if he's so far gone with his Alzheimer's, he must have something that he knows that he can go to, like, this is a button I push, or I just tap this button, or I just grab this intercom phone and I can reach someone. He must know that. Or you're just saying, or we're supposed to believe that everything went to hell in a handbasket in the course of 7 days, which would be a very extremely rare event. And I'm sorry, the dog being closed away in the closet does not sound like the sort of thing that dog lovers do. And Betty reportedly picked up dog food, I believe on the 11th. I have to listen back, but it was either the 9th or the 11th. She picked up dog food. They have two other dogs. What was going on? Did this dog have advanced age? It's really a lot going on. But moving on.
Sheriff,
Sir.
Was there any footage that came from the body cam from the house?
I'm sorry, what was
Was there any footage or anything that you can see from, like, body cam footage from the house? Any
Are you talking about the body cams that the investigator or the responding personnel were wearing?
The video, is there any video?
No, there was no outside surveillance or interior surveillance that we are aware of in the residence. So there was nothing to show the activity inside or outside the residence, and not at this time, no.
Dr. Terrell, you mentioned that one of the symptoms of hantavirus is shortness of breath. We've learned before that Betsy Hackman was laying on the floor when she was found. What kind of medical episode would she have had to cause her to fall and then not be able to ask for help?
The question was regarding shortness of breath with hantavirus and what kind of medical episode would we expect from somebody found on the floor. And I think to be able to answer that question fairly, it can go back to hantavirus infection, which initiates with what's called a prodromal phase. That's initially flu-like symptoms where a person has fever and muscle aches, that they don't feel well. After, of course, being exposed to rodent excrement. And that phase can last roughly 3 to 6 days. And then they can transition to that pulmonary phase where they have fluid in their lungs and around their lungs. And at that point, a person can die very quickly, within 24 to 48 hours, roughly speaking, without medical treatment. It's not uncommon to find someone down on the floor as part of a terminal collapse, so to speak, and that may very well have been what happened to Ms. Hackman.
You're estimating her time of death on the 11th, or is it possible that she collapsed and was alive for a couple of days?
It's hard to say. I don't think she was on the floor alive for a couple of days. I think that she went through that time period, and I don't know when she began to feel ill. And those are just things that I don't know that I'm ever going to have the answers to. But I think, and going back to that initial time period, roughly 3 to 6 days of feeling ill and then succumbing pretty quickly after fluid begins to build up in the lungs.
Given the dog was crated, is it fair to assume that the dog died from dehydration or starvation?
I don't think we know the answer to that. However, given the timelines presented, it is a possibility.
Is it possible the dog...
And I don't know when she began to feel ill. And those are just things that I don't know that I'm ever going to have the answers to. But I think, and going back to that initial time period, roughly 3 to 6 days of feeling ill and then succumbing pretty quickly after fluid begins to build up in the lungs.
Given the dog was crated, is it fair to assume that the dog died from dehydration or starvation?
Isn't it kind of hard to believe that Betty Arakawa went so quickly, having the symptoms for 3 or 4 days, but yet still she's bopping around, picking the dog up from the vet, and then going on the 11th, running around, and this is her last day of recorded activity, but she's terminally ill, deathly ill. This is just bringing up more questions.
Given the dog was crated, is it fair to assume that the dog died from dehydration or starvation?
I don't think we know the answer to that. However, given the timelines presented, it is a possibility.
Is it possible the dog had the hantavirus?
Dogs do not get sick from hantavirus.
Sure. The question was if we knew on Betsy's visit to the pharmacy if there was some medication or if she consulted with a pharmacist. We don't have that information, and I'm not sure that we can get that information due to HIPAA laws, but we don't have that information right now.
Sure.
Sir. At this point, there's no indication that there was a caretaker at the home.
Sheriff, with the footage that you saw of Betsy on February 11th, was there any indication that she was feeling shortness of breath or having trouble moving around while she was running these errands?
You know, we can analyze the video a little more, but it's going to be hard to tell. She was walking around, she was shopping, she was visiting stores, but my detectives didn't indicate that there was any problem with her or struggle of her getting around. So, and I believe she had a mask on also, so I'll have to confirm that, but yeah, that there wasn't any indication of that. Sasha?
Sheriff, this might be for you or Chief Moya, I don't know who could better answer it, but when was the last time you guys dealt with a hantavirus case in Santa Fe County, or responded to one?
Yeah, the question was last time the city of Santa Fe or the county dealt with a hantavirus case. I think we're gonna have to look into that. I'll get back to you. I would have to do some data before.
Of course, they can't answer that because it is so rare. I mean, just in my little research, I saw it's like almost it seems nearly impossible. Like I said, it sounds like some old disease like leprosy that's been wiped out or polio. I mean, there's still cases of polio around the planet, but it's pretty much a disease that's been wiped out. I mean, you can be exposed to uh rodent feces, I guess, but it just seems so unlikely. Moving on.
Have you had any communication with the CDC? Is there a concern about a bigger public health issue here when it comes to hantavirus?
The CDC is aware of this case. Hantavirus is a notifiable condition nationally. All hantavirus cases are notified to them. This is not an unusual case. We get cases every year, unfortunately. So we're not seeing any indications of any abnormal or unusual patterns.
We'll go ahead and take two more questions, and then we'll wrap this up. Is there anybody that hasn't asked a question yet?
Sure.
Sir.
Do we know, did Betsy communicate to anyone, family, friends, that she was feeling ill? Did she make anyone aware?
Again, we're going through some of the communications, and I think the cell phones may have some indications of that prior to the 11th. But as of this moment, I don't have any information that she was indicating that she was feeling ill during any communication. One more question?
Since there's no sense that this is criminal in nature, are you closing this investigation? Are you still going to be releasing body camera footage from the deputies that entered the house? What happens next?
So we will deal with IPRA requests as necessary. If there's body camera or any request for public information, we will be releasing that because of the law. But yeah. We consider this an open investigation until we close the loopholes of the cell phones, until we finish out the necropsy results of the canine, and other loose ends that we need to tie up. But I think we're pretty close to the timeline and with the information that Dr. Jarrell provided.
One question on the heart disease. Is it fair to describe this as a heart?
So, pause. It seems they're sticking to their original theory that no foul play was involved, and they don't seem to find anything else suspicious. Uh, and I just cannot say that I agree with it. I have a list of questions here. The journalists are being very respectful, the reporters. Actually, the family would normally be filling the officers in on these type of things, and I don't mean just Betsy herself. Yes, sometimes things happen in the home and everyone in the home, like with carbon monoxide, would be wiped out, but no loved one is surrounding these people.
Of the cell phones until we finish out the necropsy results of the canine, and other loose ends that we need to tie up. But I think we're pretty close to the timeline and with the information that Dr. Jarrell provided.
One question on the heart disease. Is it fair to describe this as a heart attack, or is it not? Is that not an accurate term for the heart disease that you suffered?
The question was, is it fair to conclude that Mr. Hackman died from a heart attack? And the answer to that is that it's a little bit difficult to say. I saw no microscopic evidence of a recent heart attack. However, those changes can also take some time to develop, several hours to develop, so that I can see it under the microscope. He could have had an abnormal heart rhythm. We already know that he was in atrial fibrillation on the 18th, and that could have evolved into a more terminal heart rhythm.
Is heart failure an okay way to describe it? You could use that terminology.
The question was, did Mr. Hackman have heart failure? Oftentimes we see fluid around the lungs and heart failure and congestion of the liver. I did not see that in his case. But he had very poor heart, or very extensive heart disease, and so he would have been predisposed to abnormal heart rhythms, and hence he had a pacemaker as well.
Thank you, everybody. That'll conclude the press conference for today. Thank you, everybody.
Okay, so that's what it was. This is going to conclude this video as well, but it was just about the hantavirus, and nothing to see here, folks. Nothing's out of place. Nothing suspicious. Nothing smells fishy. I still consider the Gene Hackman scene at his home very complex, very confusing, and this has not answered all of the questions. So thanks for joining me. Please let me know what y'all think. Until I see you the next time, peace.